one of the things I wanted to keep going when we had COVID coming was childhood vaccination, and I'm grateful, the teams went out, they've been to schools and settings where the children are, and they've done a sterling job. I actually have just asked for some analysis of the vaccines, and we're still double checking, but it does look like, for example, our MMR rate is not very good. Yeah, so I think it'd be unfair to say just how bad it is, because I'm still waiting for the data to be validated. But there doesn't appear to be as enough to protect our population, so we could have further outbreaks of other infectious diseases. So I say I need to find out, and then we need to revamp some of our activity around this. And again, I've seen the good sense of the people of Gibraltar. I'm sure they will rally and address that. And if I can persuade people, make sure your children are protected. After all, we've done this for our parents and grandparents. Let's do something for our children.
We'll get on to that in a moment, but regarding the decline in MMR vaccines here on the Rock, is that a direct consequence of COVID, or is it just a coincidence that now we're seeing that?
I don't know enough about that, so that's one of the things we'll look at, whether this just meant that people weren't going to get their children vaccinated, or whether this was the fact that we don't have complete data because people haven't typed it in appropriately. I don't know enough at the moment, but the figures are concerning, and I'm looking more into that. And then if they are found to be true, then we'll put measures in place to try to address that, because measles is one of those horrible diseases that can lead to encephalitis.
There is, however, an anti-vaxxer movement growing across the globe. What sort of foothold, if any, do you think this has in Gibraltar, and what can be done to combat this kind of misinformation?
So I don't think it would be appropriate for me to say whether there's an anti-vaxxer movement in Gib or not, but I can certainly see that there are people who are resonant to the messages that are sent out. I mean, a lot of this is often misinformation. What I am surprised about, and I think there's a conversation I've had with the other regulator, so the two regulators, the Medical Registration Board and the Nursing Registration Board, will be looking at the importance of healthcare professionals not to dismiss the importance of vaccination. And regretfully, I think there are people who have positions of both influence and power who are sceptical, and I think we have to start by educating and discussing and having that dialogue within the GHA and its various services, and we can perhaps then begin to address the wider issues around that, because remember, everybody knows a nurse, everybody knows someone that works in the GHA, and that if we can win that battle there, have that discussion, then I think we're well on the way to having a meaningful dialogue. And if that means registration issues, disciplinary issues, that's way downstream. But this is more about education and empowering the silent majority that I think that do believe in vaccination, because the figures bear that out.
You suggested in a tweet that children who don't have a vaccination history could be put at the back of the queue for a COVID-19 vaccine. Do you believe they should be?
No, I think what I tweeted was discuss, and I think all the conversations I've had is that we have to have a discussion. The children are, to some extent, their parents are making choices for those children. Those children have to bear the consequences of those choices, often not just for a few years, but for the rest of their lives. And we know that in order to end this COVID pandemic worldwide, we will need to vaccinate. And therefore we need to have a discussion about the importance of vaccination as ending this pandemic, and therefore out of that comes a dialogue about childhood vaccination. And as I say, I'm quite keen to have a discussion with people who are perhaps a little bit sceptical, perhaps need to be persuaded, perhaps have heard misleading information, and have that discussion, because from a public health point of view, is one of the very strong interventions we have that make a difference. That's why we spend such a long and arduous campaign to vaccinate our children. It goes on for a long period of time, and there's always new viruses we're trying to reduce. That is one of the reasons why more children get to adulthood, whereas in the past a lot more children used to die. And people know in India and Africa childhood mortality is still very high. We don't have the same mortality rate because we've managed to separate sewerage from drinking water, and we immunise.